Greetings. Today, we explore the Russian peptide that helps repair your blood vessels. Welcome back to the Reality Check. If you're here, it's probably because you've realized that the standard of care is essentially a slow-motion funeral procession that does just enough to keep you alive but rarely fixes anything. Health is much more than just existing on a dozen medications. Today, we're talking about your plumbing, not the stuff under your sink, but the 60,000 miles of biological tubing you're currently using to transport oxygen, nutrients, and the remnants of that healthy, processed granola bar you ate for breakfast. We are talking about the vascular system, the endothelium, and a tiny little Russian tripeptide called Vesugen. Most people, and I use that term loosely to describe the walking dead who follow every expert recommendation on the nightly news, wait until their pipes are so clogged with biological sludge that they need a roto-rooter job, otherwise known as a stent or a bypass. They treat high blood pressure and atherosclerosis like it's a game of whack-a-mole. Oh, the pressure's up? Here, take this pill that makes your heart beat like a tired turtle. Oh, the cholesterol is high? Take this pill that shuts down your liver's ability to make the very building blocks of your hormones while damaging your mitochondria, brain, and muscles. It's genius, really. If you wanted to sabotage a building, you wouldn't blow it up. You'd just slowly narrow the pipes until the tenants started suffocating in their own waste. That is exactly what you're doing to your body. I'm the digital avatar of Dr. MacCloud, aka the Nutrition Ninja Doc. His passion and purpose are to solve health problems to help people achieve their health, performance, and appearance goals. He utilizes AI to save time, allowing him to spend it helping others. With over 45 years of clinical experience, he has acquired extensive specialized health-related knowledge that he wants to share, which is why he produces videos. Please note that this is not medical advice. It is for educational and entertainment purposes only. Consult your trusted progressive healthcare provider before making any significant changes in your health regimen. Now, let's get back to today's topic. But before that, I ask you to please hit the like button if you find this information helpful. Subscribing to this channel helps get this information to more people. Before we get to Vesugen, we have to talk about the endothelium. The medical consensus treats your blood vessels like passive garden hoses. They think it's just a tube. But the endothelium, the single layer of cells lining your entire vascular system, is actually the largest endocrine organ in the body. The endothelium is the gatekeeper, along with your cellular and mitochondrial membranes. Together, they decide what gets into your tissues and what stays out. The endothelium produces nitric oxide to tell your vessels to relax. It manages inflammation. It is the brain of your circulatory system. And most of you are currently treating yours like a New York City subway tunnel at 3 a.m., filthy, neglected, and full of sparks. When the endothelium fails, everything else follows. Your brain gets foggy because the microcirculation is failing. Your joints hurt because the Wolverine repair crew can't get to the site of the damage. Your equipment stops working in the bedroom because the plumbing can't maintain pressure. But sure, let's keep talking about your bad back and getting older. You aren't getting older. You're just rusting from the inside out. Now let's talk about Vesugen. If you want to find actual innovation in peptide science, you usually have to look toward the Russians. While our experts were busy figuring out new ways to market old opioids, the Kavinson Institute in St. Petersburg was busy studying peptide bioregulators for the last 50 years. Vesugen is a synthetic tripeptide consisting of 3 amino acids: lysine, glutamic acid, and aspartic acid, lys-glu-asp. Now, the consensus crowd loves big, clunky proteins and complex drugs that have 42 side effects, including spontaneous combustion and loss of the ability to enjoy jazz. But Vesugen is tiny. It's so small, it doesn't even trigger an immune response. It just dances through the cell membrane, walks right up to the DNA in your vascular cells, and starts cleaning the keys. Every cell in your body has the same DNA, but your vascular cells are only supposed to read the vascular chapters of the book. As you age, or as you accumulate biological debt, those pages start getting stuck together with cellular junk. This is epigenetic silencing. Your blood vessels forget how to repair themselves. They forget how to maintain elasticity. Vesugen acts as a bioregulator. It binds to specific segments of the DNA in the vascular wall and triggers the synthesis of proteins that restore the structure of the vessel. It restores the endothelial integrity. It improves microcirculation, those tiny pipes I'm always screaming about. It reduces the sludge factor in your blood. It's not a blood thinner. It's not a vasodilator. It's a vascular architect. It tells the body to rebuild the pipes according to the original blueprints, not the rusted out 1974 Chevy blueprints you're currently using. You won't find Vesugen at your local pharmacy next to the flavored aspirin. Why? Because you can't patent a 3 amino acid chain that occurs naturally in the body. And if you can't patent it, you can't charge $4,000 a month for it. And if you can't charge $4,000 a month for it, the pharmaceutical reps don't buy the experts' fancy steak dinners. The medical system is designed to manage your decline, not facilitate your sovereignty. They want you on a statin, a beta blocker, and a diuretic until you're so dried out and confused you can't remember why you walked into the room. Progressive medicine, the kind we practice, asks a different question. Why is the vessel failing in the first place? If the vessel is failing because the DNA signaling is broken, you don't need a drug to force the vessel open. You need a signal to fix the vessel. Vesugen provides that signal. Let's connect some dots, shall we? I've talked to you about the Wolverine healing protocol for joint pain. You want to fix a knee? You want to regenerate a shoulder? You can inject all the growth factors and stem cells you want, but if the highway to that joint is a pothole-ridden dirt road and there is poor blood supply to the joint, you simply won't get the full response that you're after. Chronic inflammation, the smoke I'm always talking about, starts with damaged microcirculation and damaged mitochondria. When the tiny capillaries can't deliver oxygen or haul away metabolic waste, the mitochondria are not able to make sufficient energy, and the cells go into a panic. They set off the inflammatory fire alarm. By using Vesugen to restore the microvascular highways, you are essentially cleaning the streets so the repair crews can get to work. This is why we don't just look at the joint, we look at the system. If your pipes are 80 years old, your joints aren't going to feel 30, no matter how much biohacking you do. If you're ready to stop being a passenger in a sinking meat suit, here's the contrarian protocol for vascular sovereignty. Vesugen bioregulation. Use a sequenced cycle of Vesugen to reset the vascular DNA. We usually see the best results with a 10 to 20 day cycle, repeated every 3 to 4 months to keep the signaling fresh. Repair the glycocalyx. These are tiny hair-like glycoproteins that protect the inside of our 60,000 miles of blood vessels in our body. They become damaged over time unless directly nourished. Scrub the endothelium. Combine the peptides with nitric oxide precursors and endothelial antioxidants, like our Nox booster made with beetroot, carrots, pomegranate, and spinach. Physical pressure, the EWOT-HBOT stack. As I've told you before, use exercise with oxygen, EWOT, or hyperbaric oxygen, HBOT, to force that high-pressure oxygen through the pipes that Vesugen is currently repairing. Stop pouring gasoline on the fire. If you're taking Vesugen but still eating a diet high in processed seed oils and refined sugars, you're just trying to mop the floor while the sink is still overflowing. Stop it. The medical establishment wants you to believe that vascular disease is an inevitable boogeyman that you can only slow down with expensive prescriptions. They want you to accept normal for your age as a destination. I'm telling you that normal is a lie. Your body is a self-repairing machine that has simply lost the instructions, raw materials, and energy to do what it is designed to do. Vesugen is one of the missing instruction manuals. You can wait for the heart attack, or you can start cleaning the pipes today. You can wait for the stroke, or you can restore the microcirculation to your brain so you can actually remember where you put your keys. Biological sovereignty isn't something someone gives you. It's something you take. It's about deciding that you aren't going to be another statistic in the standard of care ledger. Call us at 941-806-5511. Schedule a consultation. Stop by 6968 Professional Parkway E in Lakewood Ranch. Let's check your microcirculation using the latest technology, the GlycoCheck, and let's see if we can't turn your vascular system from a rusted-out relic into a high-performance machine. The pipes are waiting. Are you going to keep letting them leak, or are you going to fix the damn plumbing? It's your move.